Testosterone replacement therapy, TRT, has been gaining a lot of attention as a potential solution for treating men with low testosterone levels. However, there is a great deal of misinformation and myths surrounding its use. In this video, we will discuss the truth about TRT and its impact on high blood pressure. We will look at how TRT works, what the risks are, and how to ensure that you are using it safely. By understanding the facts about TRT, you can make an informed decision about whether or not it is right for you.
What is TRT?
Testosterone replacement therapy, TRT, is a medical treatment that aims to restore testosterone levels in men with low testosterone. Testosterone is a hormone that plays a vital role in various aspects of a man's health, including muscle mass, bone density, sexual function, and mood regulation. TRT can be administered in different forms, such as injections, patches, gels, or pellets. The main goal of TRT is to alleviate the symptoms associated with low testosterone levels, which can include fatigue, low sex drive, depression, and reduced muscle mass. By replenishing testosterone levels, TRT can help improve overall quality of life and restore a sense of well-being in men with low testosterone. It is important to note that TRT should only be used under the supervision of a qualified healthcare professional, as testosterone levels need to be carefully monitored to ensure optimal results and minimize potential side effects. Before starting TRT, a comprehensive evaluation is necessary to determine the underlying cause of low testosterone and rule out any contraindications. In summary, TRT is a treatment option that can help men with low testosterone regain their vitality and improve various aspects of their health. However, it is crucial to work closely with a healthcare provider to ensure safe and effective use of TRT. Understanding high blood pressure. High blood pressure, also known as hypertension, is a common health condition that affects millions of people worldwide. It occurs when the force of blood against the walls of your arteries is consistently too high. Over time, this can lead to serious health problems such as heart disease, stroke, and kidney damage. To understand high blood pressure, it's important to know how blood pressure is measured. Blood pressure is measured using two numbers, systolic pressure and diastolic pressure. The systolic pressure is the higher number and represents the force exerted on the artery walls when the heart beats. The diastolic pressure is the lower number and represents the force when the heart is at rest between beats. High blood pressure can be caused by various factors, including genetics, obesity, lack of physical activity, poor diet, stress. It can also be a result of certain medical conditions or medications. While the exact cause of high blood pressure in each individual may vary, it is important to note that testosterone replacement therapy, TRT, is not a known cause of high blood pressure. It is important to monitor and manage high blood pressure, as uncontrolled hypertension can lead to serious health complications. Lifestyle modifications, such as adopting a healthy diet, regular exercise, stress reduction techniques, and quitting smoking, can help lower blood pressure. In some cases, medication may be necessary to achieve target blood pressure levels. Understanding high blood pressure is essential for anyone considering TRT or already undergoing TRT treatment. By being aware of your blood pressure levels and making lifestyle changes if necessary, you can ensure that TRT is used safely and effectively. Remember, always consult with a healthcare professional for personalized guidance and recommendations. The myth: TRT causes high blood pressure. There is a common misconception that testosterone replacement therapy, TRT, causes high blood pressure. However, this is simply not true. TRT does not directly cause high blood pressure, and there is no scientific evidence to support this myth. High blood pressure, or hypertension, is a complex condition that can have various causes, including genetics, lifestyle factors, and underlying medical conditions. While certain lifestyle choices such as a poor diet or lack of physical activity can contribute to high blood pressure, TRT itself is not a known cause. In fact, some studies have shown that TRT may actually have a positive effect on blood pressure. Testosterone has been found to have a vasodilatory effect, meaning it can relax and widen blood vessels, which can potentially lead to lower blood pressure. However, it is important to note that the effects of TRT on blood pressure can vary from individual to individual. It is crucial to remember that TRT should always be administered under the supervision of a qualified healthcare professional who can closely monitor your blood pressure and make any necessary adjustments to your treatment plan. By working with a healthcare provider, you can ensure that TRT is used safely and effectively while managing any potential risk factors for high blood pressure. In summary, the myth that TRT causes high blood pressure is just that, a myth. TRT is not a known cause of high blood pressure, and it may even have a positive effect on blood pressure in some individuals. However, it is essential to work closely with a healthcare professional to ensure that TRT is used safely and effectively, taking into account your individual health needs and risk factors. The truth: TRT can actually lower blood pressure. Many people believe that testosterone replacement therapy, TRT, can cause high blood pressure, but the truth is actually quite the opposite. Research has shown that TRT can actually lower blood pressure in some individuals. Testosterone has been found to have a vasodilatory effect, which means it can relax and widen blood vessels. This can potentially lead to lower blood pressure. Additionally, testosterone plays a role in regulating the balance of other hormones, such as cortisol and aldosterone, which are involved in blood pressure regulation. A study published in the Journal of Hypertension found that men with low testosterone levels who underwent TRT experienced a significant reduction in systolic and diastolic blood pressure. Another study published in the International Journal of Endocrinology also showed a decrease in blood pressure among men who received TRT. It's important to note that the effects of TRT on blood pressure can vary from person to person. Some individuals may see a greater decrease in blood pressure than others. Additionally, other factors such as lifestyle choices and genetics can also impact blood pressure. In summary, the myth that TRT causes high blood pressure is simply not true. In fact, TRT may have a positive effect on blood pressure by lowering it in some individuals. However, it's important to work closely with a healthcare professional to monitor your blood pressure levels and adjust your treatment plan accordingly. What the research says about TRT and blood pressure. Testosterone replacement therapy, TRT, has been a topic of much discussion, with questions raised about its impact on blood pressure. To shed some light on this matter, let's explore what the research says about TRT and blood pressure. Several studies have examined the relationship between TRT and blood pressure levels. One study published in the Journal of Hypertension found that men with low testosterone who received TRT experienced a significant reduction in both systolic and diastolic blood pressure. Another study published in the International Journal of Endocrinology also showed a decrease in blood pressure among men undergoing TRT. While these findings are promising, it's important to note that the effects of TRT on blood pressure can vary from person to person. Other factors, such as lifestyle choices and genetics, can also influence blood pressure levels. It's crucial to work closely with a healthcare professional who can monitor your blood pressure and make any necessary adjustments to your TRT treatment plan. In summary, the research suggests that TRT may have a positive effect on blood pressure, with studies showing a decrease in blood pressure among men receiving TRT. However, individual results may vary, and it's important to consult with a healthcare professional for personalized guidance based on your specific health needs and risk factors. Factors that can affect blood pressure while on TRT. There are several factors that can potentially affect blood pressure while undergoing testosterone replacement therapy, TRT. It's important to be aware of these factors and take them into consideration when managing your blood pressure while on TRT. Firstly, Lifestyle choices can have a significant impact on blood pressure. Factors such as diet, exercise, and stress levels can all play a role. It's important to maintain a healthy diet that is low in sodium and saturated fats, as these can contribute to high blood pressure. Regular exercise can help to lower blood pressure and improve overall cardiovascular health. Additionally, managing stress through relaxation techniques or counseling can help to keep blood pressure in check. Secondly, genetics can also influence blood pressure levels. If you have a family history of high blood pressure, you may be more prone to developing it yourself. It's important to be aware of your genetic predisposition and work closely with your healthcare provider to manage your blood pressure effectively. Lastly, other medications or medical conditions can interact with TRT and potentially impact blood pressure. It's important to inform your healthcare provider of all medications you are taking and any underlying medical conditions you have, as they can affect your blood pressure management. By considering these factors and working closely with your healthcare provider, you can effectively manage your blood pressure while on TRT. It's important to regularly monitor your blood pressure and make any necessary adjustments to your treatment plan as needed. Remember, everyone's situation is unique, so it's crucial to seek personalized guidance and recommendations from a qualified healthcare professional. Managing blood pressure while on TRT. When it comes to managing blood pressure while on testosterone replacement therapy, TRT, there are a few key considerations to keep in mind. Firstly, it's important to closely monitor your blood pressure throughout your treatment. This can be done through regular checkups with your healthcare provider, who can assess your blood pressure readings and make any necessary adjustments to your treatment plan. Additionally, lifestyle choices play a significant role in managing blood pressure. Maintaining a healthy diet that is low in sodium and saturated fats can help to keep your blood pressure in check. Incorporating regular exercise into your routine can also have a positive impact on blood pressure, as physical activity helps to improve cardiovascular health. Stress management is another crucial aspect of managing blood pressure while on TRT. High stress levels can contribute to elevated blood pressure, so it's important to find healthy ways to cope with stress. This can include practicing relaxation techniques, such as deep breathing exercises or meditation, or seeking counseling if needed. It's also important to be aware of any other medications you may be taking that could interact with TRT and potentially impact your blood pressure. Inform your healthcare provider about all medications you are taking so that they can make informed decisions about your treatment plan. In summary, managing blood pressure while on TRT involves close monitoring, adopting a healthy lifestyle, and being aware of any potential interactions with other medications. By taking these steps and working closely with your healthcare provider, you can effectively manage your blood pressure and ensure safe and successful use of TRT.